It's scary how many women are becoming addicted to prescription painkillers. If you've gone to the hospital for some type of surgery in the past, you probably left with a prescription for a strong painkiller like Oxycontin or Percocet. But do you really need to take something so powerful for post-procedure aches? According to Healthy Women, the nation's leading independent health information source for women, 1 in 15 patients who get prescription painkillers aka narcotics or opioids after surgery end up using them long-term, which can lead to dependence and addiction. That's a pretty huge number considering that doctors in the U.S. write 70 million prescriptions like this each year. The even scarier news: the number of women dying from prescription opioid use keeps going up. According to the Centers for Disease Control and Prevention (CDC), every 3 minutes, a woman goes to the ER after abusing prescription painkillers. And in 2010, the latest year for which stats are available from the CDC, 5 times as many women died from overdosing than in 1999. And this is happening to women your age. Those between the ages of 25 and 54 are more likely than other age groups to go to the hospital for prescription painkiller misuse, per the CDC. That's why Healthy Women launched the Voice Your Choice campaign yesterday, November 17. For the campaign, Healthy Women surveyed 744 women ages 21 and up who had surgery in the last 10 years, asking them about their use of and attitudes about prescription painkillers. This surprising info: 90% of the respondents said that they would like to avoid taking narcotics after surgery because they know that this can lead to addiction. 80% of the women said they took them anyway. What's more, only 27% of those asked said they had a convo with their doc before surgery about their pain management options, even though they all said they would like to have more choices. I think that disconnect is in part responsible for the addiction, says Christy Funk, MD, a board-certified surgical breast specialist who founded the Pink Lotus Breast Center and has treated celebs like Angelina Jolie and Sheryl Crow. The idea of using non-narcotics is never discussed. Patients don't bring it up, the surgeon doesn't bring it up. Patients have their surgery, they're given their prescription, they go home with it and say, "I'm in pain," so they take it. But maybe they could have minimized the pain by using non-narcotic alternatives. Funk points to multimodal pain management as a safer, non-narcotic alternative. With this method, surgeons administer pain meds before surgery, inject it during the procedure, and then give it to the patient again right afterward. This results in less need for narcotic painkillers post-op. Certain people are prone to biologically crave the effects of narcotics in their body, says Funk. Think of it like alcohol. Some people can have 2 glasses of wine and don't have any cravings to drink the next day, and that's the difference between them and alcoholics. Funk explains that there's something biologically activated that creates the craving. This leads to tolerance, meaning you need more of it to achieve the same effect. And then, your body is so saturated with that narcotic that it actually depends on it. It can function the same without it. Above all, Healthy Women wants to open up a discussion and empower women to speak up to their doctors if they're having to surgery. Women need to be educated and empowered to approach physicians and not think they're going to alienate or upset their surgeons by asking a few basic questions, like how much pain you can expect from this, how long the pain will last, and what the plan is to manage it, says Funk, who adds that, for the majority of operations, you really don't need to take narcotics to manage your aches afterward. I think surgeons just knee-jerk into writing narcotic prescriptions as a backup so their patients aren't worried, but they're not offering anything less than that, says Funk. So they end up taking the most potent medication possible for something that could use ibuprofen.